All right. Well, thank you everyone for joining us here today for the FIC Coalition meeting. I see we do have some new faces, so that's always nice to see. So if you can kindly state your name and what club you're from or where you are located before you speak, that will be helpful to everybody. So what we'll do for today's agenda is start with our government lobbying, and then speak to current impacts of COVID-19, and then reopening strategies. We have a few provincial updates that we want to review today. But another thing I do want to make sure we do touch on today, and I know it's a big discussion, so I just want to get it started today, and that's going to be kind of the outlook for the future of fitness businesses. So we want to be talking about big box, we want to be talking about studios, personal trainers, virtual. So I will have Scott discuss a little bit about big box. Dave Hardy, if you are on, to talk about studios, personal trainers, Mo, and Nick Corneal, if you can talk about virtual. So keep in mind, open forum. So if at any point you do have any questions, concerns, comments, please let us know. So with that, let's see if Chris is on. There he is. All right, perfect. So Chris, if you want to kick us off.
Yeah, no, thank you. Thank you very much. It's good to see everyone. As you said, Tricia, some new faces to the group as well. So I won't take too long, but I do want to update you briefly on three things. So the first thing is fairly hot off the press, and some of you may have already seen this, but today the government has officially extended the Canada Emergency Wage Subsidy. So that has been extended from the original June 6th deadline and will now go right to the end of August. So August the 29th this year is the extension for the Canada Emergency Wage Subsidy. So that was some good news today. The second thing, and obviously something that we've been working on, is the rent subsidy issue and some of the challenges with that announcement that came out 2 weeks ago. And obviously one of the challenges, and Tricia and I were talking to the minister's office yesterday, are that it hasn't even rolled out yet for landlords to be able to punch into through CMHC. So Tricia and I did have a call with Ivana from Minister Ng's office, Minister of Small Business. I thought it was quite good. She takes the time to listen to us, and we have been feeding her some information from the membership about some of the challenges with the rent subsidy program as it's currently constituted. She did say that, while not letting too much out of the bag, she did say more information on the subsidy program can be expected on Tuesday or Wednesday, was my understanding. And Tricia, correct me if I'm wrong, but she said that it looked like the Prime Minister or the Finance Minister will make some clarifications, updates to the program that was announced 2 weeks ago. So we're obviously hopeful for that, and based on some of the advocacy that the Retail Council is doing, I would suggest, Tricia, that after that announcement, we can send our own letter to Minister Morneau and Minister Ng, based on what that new announcement would entail next week. Ivana did say that continuing to put pressure from groups like ours onto provincial representatives and provincial finance ministers will be helpful and help the government continue to push this along. And I don't know if you have seen it also, but or if Tricia, you circulated it maybe, but the CMHC has updated the FAQs on their website. There is more information on the website for that as well. So that's it. That's it in a nutshell. Tricia, I don't know if I missed anything from yesterday.
No, I think that is what we covered. And if anybody has any questions, and I did send out the Q&A last night. So if you received that email, it is in there. I can send it again to anyone who has missed it.
Chris, it's Nathalie from Montreal. Having had said conversation with the finance minister's office in Quebec yesterday, they literally told us to go back to the federal government. So there's a little bit of ping pong happening there. They say the federal government knows it's not working because nobody's taking advantage of it. The numbers are down, but they said, we will support what they do. And they said they told them it's not working for people in Quebec, but go talk to them. And I kind of feel like if we want to go back to them, I have to have something different than they said to come back to you. So what would be your suggestion in that case?
Right now, I want to wait and see what happens on Tuesday, to be honest with you. So I think we're going to hold until we see what happens on Tuesday. So if we see something on Tuesday or Wednesday that will expand the program and be more helpful to us, if it's not, then we have to figure that out and I think ramp up our advocacy on that, both at the federal and provincial level. But I'm holding out hope that what we have been sending the minister's office and what folks like you have been communicating and other groups like the Retail Council have been communicating. I get the feeling that Morneau is going to take the reins on this a bit stronger and make some of the changes. I don't know if it's going to go as far as we had originally said, Tricia, in the op-ed that we had crafted about having businesses be able to tap into it instead, or in addition to the landlords, to make it a little bit more usable, I guess. So that's what I would say, Natalie. Let's wait and see what happens I think something's going to happen on Tuesday. That's, again, Tricia, correct me if I'm wrong, but I really got a strong indication from Ivana that wait and see what's happening next week.
Yeah, they did say early next week we should hear from the federal government. So fingers crossed that it is something in our favor. But if we don't hear back from early next week, I think then we can approach them again to figure out what's happening and why announcement wasn't made.
Okay, I appreciate it. Thank you.
Sorry, this is David Brodman from IFH in Alberta. So the ping pong issue, isn't that just because government money is not enough to cure this problem? Don't they have to just focus on taking a timeout on mortgages and doing this through banking? Like, the feds always point to the provinces. The provinces always point toward the feds, but provinces don't have money for this in reality. So they can give whatever answer they want, but they just don't have the money.
Yeah. No, I agree with you. And that's why I think,
thank you.
Like, I want to see what happens next week, obviously, and the clarification that the minister's office will come out with. And I'm hopeful that they will fix the problems that are coming out from it that we're seeing.
Central bank just needs to freeze debt obligations of the banks relative to the mortgages, and then the landlords will have lots of freedom to make deals with tenants.
Yeah.
But you can't pay enough from the government into mortgages, which is the current approach, which is why it doesn't work.
Yeah.
Oh, there we go.
Nice.
Any other questions about the wage subsidy program?
Can I just mention the tax credit issue that we're working on too?
Yes, absolutely.
So we have also started some advocacy on the adult fitness tax credit issue that FIC has been advocating for. I want to say, Tricia, over the larger part of 10 years, off and on, right? So traditionally, the Liberal Party has not been in favor of tax credits like this, and we've seen that in that it was in the Conservative platform in 2015, right? And they were going to institute it similarly to the children's tax fitness credit. So we have been starting to run this up the flagpole, and again, we spoke with Ivana in the minister's office yesterday about it. There definitely seems to be more receptivity than I would have thought, to be honest with you, with the adult fitness tax credit. So I'm pretty pleased with initial conversations that we have had with the minister's office on that, and we will continue our ramping up of our efforts with members of Parliament and members of the Finance Committee in the coming days and weeks as we put that in the window for something that can help, obviously, Canadians and fitness organizations as well moving forward.
Scott, was there anything you would like to add to that?
Regarding tax credits specifically?
Yeah.
No, I don't think so.
Okay, perfect. All right, thank you. So we will be sending out a letter that kind of composes what it is that we are looking for. So we'll have that drafted out.
Yeah.
Any other comments on that before we move our meeting along? All right. So with that, let's move on to reopening strategies. And we do have provincial groups that have been looking at reopening strategies and meeting with their provincial government. And just a quick update from the provincial groups, which would be great. So we do have PEI, we have Quebec, we have Ontario, who is just going to be getting mobilized. And then I know Alberta did their meeting today. I know Saskatchewan already met with some of their leads there. And then we have BC on its way. So let's maybe start with Quebec. If Natalie, you can give us an update with what's happening.
Sure. So our meeting with Quebec, even though it was with the finance minister's office, actually led to reopening procedures because the finance office said not to ask them about anything related to money. So that's what we talked about. And there seemed to be concerns about how gyms could open within the confines of what public health organizations are asking across the province. And the three ones that they brought to us, so it's not that they're not talking about it, but rather that they're kind of wondering how we can make it work. So it's great that we actually heard what their concerns are because it helps us dig in a little bit deeper into the reopening procedures. One of them was, as I shared with you guys last week, that they're concerned that gyms aren't necessarily sanitized on a regular basis, so there's a higher risk there, which is a strategy in the communication that we put through of everything we've always done to keep gyms really clean and safe. And the fact that we are a industry that's focused on health and fitness was a big part of our communication strategy. So their first concern has to do with capacity. The Quebec government seemed to wonder if we were calculating capacity based on total square footage versus based on occupiable capacity, to which we said, of course, we're doing it the right way. We're doing the calculations based on occupiable capacity. Their concern was how we would manage the need. They had very much a appetite for the idea of booking systems, controlling systems, appointment systems, in which we would control who would even show up to the facilities. There was a lot of like, oh, you guys are willing to do appointments for everybody. That seemed to be, I didn't say yes, because I didn't want to commit to that. I said, yeah, it's something we're looking into, but they seemed to be very happy to know that we were looking into that. I think they imagined having 50 people in a parking lot and us not being able to manage those kinds of things. So that's the first one. The second one was touching pieces of equipment. The fact that there's a lot of equipment in there. And they said, on an ideal standpoint, you'd have members come in, sign some sort of waiver saying that they would clean up after themselves and also clean up before themselves. They just want things sanitized and cleaned as frequently as possible. And so that was another message they want to make sure we're taking care of, which we all are. I know we all are. And then the third concern was masks, because he confirmed the fact that they don't think that the virus is transmitted by sweat, so they're not worried about that, but that we're breathing more heavily. And so it was even if you guys say everybody has to wear a mask, he literally was saying, he's like, I don't imagine how you can make that happen because you're sweating, you're on a cycling bike, you're sweating, you want to wipe the sweat off of you, you take the mask off. He was kind of like throwing his hands up in the air saying, how does that even work? Is kind of where he was when it comes to that. The Quebec government is, I dare say, very close to imposing making masks mandatory in public, certainly in Montreal being the worst city in Canada when it comes to infections and the growth of that. They've just confirmed today the millions of dollars they're making accessible when it comes to masks. So that was the concern of like, how would you guys even kind of figure this out? If masks were mandatory, how would that work? Which kind of, tailors into some of the feedback that I've heard from you of a lot of the members are saying if they have to wear masks, they won't do it. So we're still sticking in our reopening protocols with highly recommended and made available for both staff and members until or unless the government changes it to mandatory in public. If they make it mandatory in public, then we won't have a choice. But for now, our line is kind of sticking to that. So those were the 3 sticking points that they had. And I reviewed everything on the reopening protocols that we prepared. I sent them to Scott in French, but gave him a good app to switch it to English so he could see what we had already done. I think the idea of us in Canada working together for a lot of those things, there's little idiosyncrasies which can be switch province to province. For example, here there's a big concern of moving from one region to another. The fact that most people don't drive more than 5 kilometers to go to a gym helps us, even though they're opening golf courses on Monday, but that's another story. And so trying to stick within their concerns, the national concerns, the COVID concerns, as well as the provincial concerns, I think might be a great strategy moving forward. Our next step is CNSST. I don't know, that's a giant acronym that essentially it's like the Employee Work Protection Agency thing of Quebec. So we're looking to meet with them next and show them our reopening protocols. Once it is approved by them, then we get in line, because the province is still opening up the funnel very slowly towards people being in public and moving around. But the next step is have it approved by that part of the minister's office, the work minister's office, and then we wait. So that's where we are with that.
Can I ask a couple questions about that?
Sure.
That was really a helpful explanation of how at least that group's seeing it. So to me, everything that was described are the concerns with all businesses. And I'm wondering, I'm not trying to ask this to be smart, I'm trying to understand what the source of the difference is. But with respect to surfaces in the gym, if I compare that to the surfaces that people touch in a retail store, in my mind, it's not even close. We would have significant less exposure there, even if we weren't all sanitizing equipment all the time and providing members that same opportunity. So that's I guess one point. And then the second point is, and some provinces have aligned with restaurants, but what is the view on why distancing will be so much harder than in a restaurant?
So the distancing part isn't one that, and I mean, restaurants are nowhere opening in Quebec either, but the distancing part isn't the concern for them. They were worried about how we could handle capacity, which was the first point. And then mainly the, because breath might go further, he didn't mention making distance different. He mentioned masks, which I think is, I mean, it's a double-edged sword. I would rather us have to go maybe the mask way than have to go from 2 meters to 10 meters. Because if it's 10 meters, then I don't know if there's, we'll have 4 people in our gyms. And so he didn't say your distance will have to be further. When we mentioned we were doing the 2 meter thing, he was like, yep, because that's the same standpoint and standard that everybody's going with. He felt more that if people even do wear masks, how would that work? As it relates to your point for the cleanliness and ease of sanitization of gyms versus retail, I completely agree with you. We're trying to choose our strategies of where to tell them that they're being silly versus show them how we are actually our surfaces are very easy to clean. If we have to say they're easier to clean than a box, you know, the array of Fruit Loops at a supermarket, we can get into that. But for now, we're sticking with here's how we've always kept our surfaces clean. Here's how we've always focused on the health and wellness of our members and our communities. We're sticking to that convincing them that we've always done it and we'll continue to do so, if not more, moving forward, is kind of the strategy that we've been using with the lobby firm.
Okay, and then one last follow-up on this is from a overall impact standpoint, net impact standpoint, you know, my understanding of provincial projections across the country are that really the official projections wherever they've been released are that eventually no less than 20% of the population will get it. So really what they're talking about with all the regulations and standards is slowing the spread and mitigating the issue, not stopping COVID in its tracks.
Mm-hmm.
And so with that in mind, there are significantly different outcomes in a healthy and fit population versus a non-healthy and fit population. And is there any ear for, you know, we believe we can mitigate with distancing to the degree that other businesses can. And then on top of that, we have a protective benefit that we're helping to support the public with.
Yes, and which is why the Quebec government, Isabelle Charest's department, so Minister of Education, Sport and Women's Issues, this week laid out the only phased plan that's available in Quebec now is sport and fitness, because she's an Olympic athlete. So they're trying very much to do it in steps that are based on keeping gatherings to a minimum. And in their head, for them, gyms are places where people gather. Even if it's not all people, it's places where people gather. So as of Monday, you can do individual one-on-one unsupervised sport outdoors. Thank goodness we can all go scuba diving, according to the Quebec government, starting Monday. And then after that, it goes one thing after another. The next one is supervised outdoors. Then it goes to organized sport, indoors, no fans. And there's a 5 type of, and we're very much towards the end of that, which is supervised indoor sport in groups. And to them, that in the yes, we want to get people moving. The fact that it's summer this would be a lot easier if it was December. But in their heads, they're like, yes, physical, mental, immune health is great. Everybody get outside, stay away from one another, and start exercising. Is the strategy that they've taken. Before they allow them to be indoors in groups, to them, we're a few steps away from that. And therefore, our businesses fall into that category.
So Natalie, I think the proposal, the document you sent me was wonderful and really well thought out. So I want to commend you and the Quebec group for really taking the charge on this. And thanks for also teaching me how to translate French documents into English, so now I can actually help my kids with their homework. But I also want to share that we were on the Global Federation call yesterday, and New Zealand was successful lobbying their government to move from one phase to the other. They were lumped in with nightclubs, much like Alberta has been. And they were successful moving faster. And so now they're actually open. And a couple key points. So this is for all the provincial council members who are going to be part of your committees that I took away from the call yesterday. One is we have built-in contact tracing. So if we are moving to, attendance by appointment through, an app or through a registration process, that is contact tracing. So on demand, if they need information, we have the ability to give it. The proposal should be robust, where it's actually, we need to let the government know that we have this under control in terms of our policies and procedures, and we got to get really granular on how we're going to sanitize and clean the facilities. So, you know, in the proposal, say that there will be stations, hand sanitization stations, wipes, you know, throughout the facility. This is how we're thinking facilities could reorganize their floor plan or think about spacing. So their document was really quite well thought out, and we'll obviously share that with everybody. One of the things that he highlighted as well, so this is Richard Beattie from Exercise Association New Zealand, is we're not sport. So Natalie, what you just mentioned with the kind of the sport rollout, they wanted to make sure that that the government understood that a fitness center, a health club, a studio is not a sport. We are much more organized in terms of controlling of traffic flow. And then the last thing to focus on, and I found this pretty interesting, was in your proposal or in your conversation with your provincial health authorities and finance ministers, try not to talk about if we don't open, we're going to have financial consequences to our business. The reason for that is there's fatigue, right? So the ministers have heard that from every other sector. And so they're at the point now where they're just resigned to that fact. Rather, focus on the financial impact of inactivity. And we do play a key point in getting and keeping people active. It's one thing to say go outside and social distance and exercise. We all know that people don't know how, and they need supportive professional assistance to build and maintain that behavior change. And that's where we come in. So we need to focus on the fact that we can get people active and keep them active, which has an economic benefit. So I just wanted to share that as each of our provincial councils embark on our, crafting of the message to your provincial health authority.
Scott, do you think it's worthwhile taking the English version of what we had prepared? And somebody asked about it because it's a French PDF document. So I sent Scott the Word one, and make more sense to have a look at that in English and send it around for FIC to kind of take that and take the New Zealand one and do a bit of a template of here's what we have. Because I feel like everybody, literally even in our group, there's 6 people in Quebec that sent a bunch of things, and because people have ants in their pants and they want to get something, they want to get busy in something, but we're doubling the efforts and time and everything else. So could we collate that and include those best practices from New Zealand?
Yes.
And then, okay, great.
And that's basically what I've done for Alberta. I've basically, why reinvent the wheel? New Zealand has a great template. I found your template really well done. So try not to reinvent the wheel. So absolutely.
Okay. And by the way, to Scott's point, to support Scott's point about the fatigue when it comes to finance, we told the finance minister's team when we spoke to them, we said, you know what, it could be up to half of our businesses that are going to close in the next few months if we don't reopen. And literally his comment was, I know. And that's it. So that they're like, almost like, welcome to my life, is pretty much the message he was saying there. So to support Scott's point, that didn't get us anywhere.
So I've sent Tricia the New Zealand document and as well as the template. I'm having serious internet connection issues today, so I don't know if she got it. That's why I'm on my cell phone for this meeting. But we'll get that out to everybody.
Yeah, I'll definitely look at all of that and compile the information and put together a template and send it out to the group.
So a couple of things, Natalie, that information is great. And to Scott's point, I guess to build off of that, something that we've been messaging a lot more in the last year and the FIC has sort of started to pivot towards is speaking about fitness as prevention. So obviously there's a big opportunity here to really push that message forward about, and there's so many more studies that have come out in the last year about, activity and fitness as prevention in healthcare. And looking at us as an extension of healthcare, as a preventative extension of healthcare, as opposed to sport in that sense. So I think that there's an opportunity to really push that message. The spread question, I think, is really difficult. Natalie, I think you've hit it on the head there. You know, we don't want them saying, okay, you know, some people have said that breath spreads 10 meters when people are running and whatnot, and that'll mandate spacing that will make capacity not feasible for people. So it might just have to be masks. One of the things that came up in a conversation offline of the meeting from a couple of us last week was, I mean, obviously the risk is that the mandate versus suggestion, we make all these suggestions, then one club, you know, doesn't follow them and puts too many people in, and they get a spread, and it sets the entire industry back, and that's something really difficult. So I'm not sure. Obviously, the industry couldn't mandate it across the board, but it might come to giving these parameters to the health authorities and saying, this is the industry thinks this is the standard that needs to be had for people to be open, and the health authorities are going to then mandate that at a province by province level to say, if your gym wants to be open, here's the conditions, the same way they have in retail. So in a way, you know, if we've set the parameters and given those to the health authorities who then mandate that back down, as opposed to us trying to tell everybody in the industry, hey, here's what you have to do to open, because we won't have the authority to do that. But that might be a way.
That's what happened in New Zealand. That's exactly the play that happened in New Zealand.
And that's probably what we're going to have to look at here, right? Which is we set what the rules are or we at least, you know, suggest what the rules should be, so that the health authority can say, okay, we're not going to lump you in with nightclubs, but here's the rules for fitness industry. If you want to open in your province, you know, here's the criteria for any facility. And that way we make sure that everybody is playing by the same rules. Everybody who's opening is being safe, and we don't have that one incident somewhere that sets everybody else back.
Great, thank you, Nick. I am going to move on to BC right now. I know BC is getting their group together. Lee from In Charge Life actually did a really good webinar earlier this week about kind of the reopenings. Lee, do you want to give maybe a quick recap of like the 4 specific pillars that you had spoken about during your webinar?
Hi there. Yeah, so the main ones were obviously a standard operating plan in terms of making sure that's fully up to date, like you've all mentioned, so that you have all your information for your staff training, your documents, your sign-off documents, your HR documents, everything you guys should have already, but just basically bolster it up round about the COVID. And then also your emergency action plan, which seems to be overlooked by a lot of health clubs, and what you're going to do for first aid procedures, what you're going to do for your evacuations, what you're going to do for your fire code if you are moving equipment around. So a lot of it is round about the operational side. And then we also touched on the physical design of your club, which you're all speaking about already with your, whether it's 6 feet distancing or 10 feet distancing, and how your one-way system around your club will actually work if you can do a one-way system. And then the last part we touched on was just the recovery plan of your business, in terms of how quickly you're going to get your business back up and running once you actually open your doors again. So is that going to be 90 days? Is it going to be 180 days? Is it going to be a year? But really start to manage that cash flow as you open back up again. So that was kind of the main 4 points that we covered on that webinar yesterday.
Great, thanks, Lee. And I think that's a good point, the last point about cash flow and how to get things started again, which is something that I do want to touch on. But Carl, do you have anything you would like to add on the BC front, maybe?
Yeah, so some of the things that, you know, we had a call with Workplace BC on Friday of last week. We reviewed, we mirrored a lot of the suggestions already being made in terms of distancing. We went in with a strategy just based on what the provincial health authorities in BC suggest are the best ways to combat COVID. The biggest one was distancing, and the second biggest one was just sanitation, cleaning. So we went in with a strategy of proving that we're able to create the distance needed within our facilities, and create a 6 foot basically radius between team members. So they were mostly looking for how we were going to create distance. Everything else, we brought up our staff were going to wear masks. We didn't mention that our members would be wearing masks. They didn't really seem to care too much about the mask part of it. They were excited, extremely excited, just like somebody had mentioned about the possibility of us having our members book in prior to coming in, because they as well mentioned that that would be a source of contact tracing. So, you know, opening up your facility can be seen as a benefit rather than a hindrance to the government in that respect. If there is an outbreak in a certain community, they'd be able to come to us, and we would have some contact tracing opportunities for them to review with us. I know a lot of the talk in British Columbia right now is about when fitness clubs can open. They've been really basically non-committal to that. I do believe that there's going to be some organizations, some gyms, some studios that are going to open on May 19th, and I don't know that there'll be any pushback as long as they're following distancing rules. I feel, just based on the conversation with Workplace BC, they wouldn't give us a definite answer. Their position is that as long as staff are safe, we're okay. But you hear our hero Bonnie out in BC, she doesn't, and Horgan doesn't really give any clear indications as to when big box facilities can open out in British Columbia. So, for example, clubs with more than 50 plus people. I think the feeling out here in British Columbia is basically what we're going on right now, and we don't feel that before June 1st. The public feels like we're ready to open up, is our opinion, in British Columbia, and so that's sort of the temperament here. Most of the club owners, operators out in British Columbia I've spoke to feel the same. June 1st feels like the appropriate date to start to begin to open. I don't know that Club 16 is going to open by June 1st, just because we want to make sure that the timing is right and that we do get the go-ahead from the provincial health authorities, so we have their backing going in. And they may never give us that, as we all know. Like, they may just continue to say, well, you're the professionals at this business. You do what you think is right, and we'll come in after the fact. I'm a little nervous about facilities opening up before June 1st, because the ones that do open up on Tuesday are representing our industry, basically. And I don't know that a lot of them are on these calls with us, and a lot of them are hearing some of the things that we're suggesting. So I'm a little nervous about how we're going to be represented in BC after this May long weekend here. So I'm hoping that things go well, because it will affect our whole industry across the country, how British Columbia opens over the next little bit. So anyone on the call from British Columbia that is opening and wants some advice as to some of the standards that they put in place, that we have all been on these calls and talking to each other, and we understand what the province is looking for, you can feel free to email me if you trust me. My email I'll put in the chat here, but we definitely want to make sure that BC is setting the tone here as for the rest of the country, doing the right things, and proving that the industry can do the right thing. So share with your friends that are opening up their studios and their yoga shops, and their personal training studios, and share all the information you can with them so that they're doing the right things and representing us well. I know it was sort of flight of thought there. I wasn't prepared to say anything, but yeah, we're taking the same standards that you've heard, distancing our equipment. One of the things that we are considering, and maybe somebody can either push me off the ledge or pull me back in on this decision, the one that I have in question is we do have some equipment that is bolted down. So let's say, I see Jeremy's on the call here, so some pre-course selectorized strength equipment that may be bolted down in our facilities, and we're wondering whether or not, if they aren't 6 feet distance apart from each other and we can't move them 6 feet, if we should leave them all open and put signage up saying, if somebody's on this one, you can't go on this one, or should we shut down every second one? We're sort of torn on that. That's really the only question that we have. And if we can't sort of get a solid answer, we're just going to shut down every second one. Ultimately, it takes away from the experience of working out, but then we're also sort of leaving it up to the customer or the member to use common sense in that regard. I don't know if anyone wants to speak on that.
I think the more we can control traffic flow, the better. And common sense is not common sometimes.
Yeah.
So I think the government would appreciate the more we can control traffic flow, the better. Even in locker rooms, right? Like saying you can go to locker number 10.
Yeah, well, I appreciate that. Yeah.
Angela, can you hear me?
Yeah.
For sure. Oh, okay, there I am. I have difficulties here. I have to figure this out. We won't have the problem of too much equipment bolted down, but personally, I would say, just have every second one only available. I'm going to be more concerned about what Troy Dalton sent around was that registered kinesiologists did get advice from the government not to open until mid-June, and exercise specialists, so I don't know if we are falling under that, are included. So I actually pushed we had prepared for June 1st, but I pushed now to June 15th. Anybody, any ideas there?
Sorry, Angela, I'm just going to ask you to put your volume down a little bit because there's a lot of feedback. I believe Angela's question there was that they had planned to originally open on June 1st, but are now planning to move to June 15th?
That's correct. Yeah, it's just Troy Dalton sent out a letter, and registered kinesiologists did get an email or a poster from, or text, whatever it may have been, from the Ministry of Health, and said that they are definitely not working phase 2. They will be part of phase 3, possibly mid-June, but no date is given.
Okay, thanks, Angela. Sorry, you have a little bit of feedback on your end, so it's a little harder to hear you.
I think her concern is that there's a email that she got a hold of that suggests that kinesiologists would not be able to be a part of this phase 2 in British Columbia and instead would be in phase 3, which was sometime in mid to late June. So she's wondering if anybody has any information for her on that. She initially was going to open up on June 1st. She has a personal training studio and is wondering if the kinesiology sort of suggests that personal training in British Columbia should not open prior to mid-June when they get the green light. If anyone else has heard anything else on that. And Angela, I know we spoke this week already. I don't have any information on that. Club 16 is not going to be offering their personal training in what we're considering our phase 1, but it's a different story for us. Obviously, that's your main source of revenue. So if anybody knows anything about that, they can speak up, I guess.
Carl, this is Mario in Ontario. I'm wondering if you've considered putting up barriers between your equipment that's bolted down.
Yeah, so we have an order of plexiglass coming in for, like, I guess, sneeze guards for reception, as well as some of our sales tables in our facilities. But there's such a shortage out here on getting plexiglass that's just not an opportunity for us if we're going to open in June. So our intent is to do that, but we don't have the resources here in BC. Angela actually gave me a resource to find this sneeze guards, which is great. Thank you, Angela. So we ordered those, but there's just the resource of plexiglass out here for the same reasons is not available for us. And if it is, it's at a cost that is just it's unreasonable at this point. I was hoping that I could convince Jeremy from Precor to just supply us all with free plexiglass for between our equipment. What do you think about that, Jeremy?
Well, we've got a few suppliers on the call, so there's a little nudge to what is desired.
Tricia, Scott, maybe just a thought about this is that given that people are already moving on this and that the idea of like getting this mandated from health authorities is probably going to take some time, would it behoove us at the FIC to maybe put out some sort of press release that's regarding to what the standards the industry is like, hey, this is what the FIC has said for gyms, so that we've at least said what the industry is suggesting the rest of the industry does, and it gets out to the public so that they know what these stuff is. Is that, Have we already put something out, or are we planning on putting something out like that? Because it seems like if people are going to be opening potentially on Tuesday in BC, that we might want to put something out that declares what, as an industry, we're expecting and what the public should expect and what they should be holding their own fitness people accountable to, something like that.
I don't think we're ready to do that today. We might be ready to do that by next week once the people on this call can view the documents and give feedback. You know, this has happened relatively quickly, but I think we need a little bit more time to have a well-crafted message. But we'll get the documents out for review for everybody for feedback. And, you know, I'll just say, like, in regards to the barriers, New Zealand's recommendation was they can do barriers if they can't accommodate the physical distancing, then they have barriers. But if you can accommodate physical distancing, there's no need for barriers. You know, same thing with masks. So they didn't mandate one way or the other. It was, you know, one or the other, which I thought was really smart. So, but we'll send that document out for review and we can get feedback on it.
Yeah, that's a helpful strategy. Thanks for sharing that.
Yeah, we'll definitely do that. And then on Monday, actually, we sent out a list of guidelines of things that we have collected from our global partners. And if you have seen that, that went out on Monday to our mailing list, and it is actually available on our website, but we have not turned it into a press release or anything. So once we kind of dwindle down on what we think the industry should be focused on, we can then reach out to the public.
Hey, Carl, this is Sheldon from Free Motion Fitness Canada. I'm actually in BC as well. And I feel your pain because it's an actual order. So the provincial health minister is basically given the power to the municipal or the area provincial health officers to make orders. So there's an order from Fraser Valley right to the river that it's an actual order, that gyms are still closed. And then the talk is everything kind of west of the river. Everybody's talking about opening up like next week and, you know, before June 1st. Like I've had several conversations with people about that. So I echo what you're saying. Like they're not on, you know, they should be on these calls and they should be getting the information because they just want to open up because they're losing revenue. They can't pay the bills, blah, blah, blah. They're not thinking this thing through. So, you know, I'm with you. I really wish a lot of them were on this call. What I've been doing is I've been sending them the LinkedIn link as well as the website to FIC and telling them as owners that they should probably check this out and just see the information. But because Dr. Bonnie Henry kind of said it the other day that, you know, the order is only for really the Fraser Valley East. It's kind of opened up a whole bunch of conversations in basically Burnaby all the way up to, I had an argument with a guy in Squamish, you know, just about opening up, and he feels that it's his right to open up and he doesn't need to follow many things. So it's, yeah, I feel your pain, and I'm trying my best to direct a lot of information back to FIC with some of these owners that aren't on this call. So we just get the hope and pray right now.
Yeah, thanks, Sheldon. I really appreciate that. Thanks for sharing that. Feel free to send me an email as well if you want to connect with me. And I'm doing the same as it comes to Fraser. I know this is not Canada-wide. I'll make it quick. But as it comes to Fraser Health, we aren't allowed to open until June 1st. And then, of course, in the areas of Vancouver, it's sort of up in the air because there's no mandate to stay closed. But I appreciate you sharing that information and sharing that with me as well. Feel free to send me an email.
Yeah, I will, for sure, buddy.
Thanks.
If I can take the screen here, we're talking about plexiglass, and we have the same problem here, of course, in Quebec, the cost and the availability. So I was looking for another idea, and I don't know if someone can say if it's a good idea or not, but I was thinking about, you know, the vinyl that is used for the windows of a boat. you know, the boat on the water. Yeah. So it's a PVC. It's 100% PVC. It's very thick. I look for the price of material like that, and I think maybe we can find a way to build a nice frame and to be able to have a separation at a very lower cost this way. And with this type of vinyl, you see very well, you can see there is different color, even if you want. But I think that from what I look, because I was looking because of the space also, if I can create something different and not using PVC. And I think that there is something to do there with that material. So that's a suggestion. And this is something that I will probably try to do in my gyms, because really the cost and the availability of plexiglass is out of our possibilities. So that's something that I suggest. There is different thickness. There is even some of that material that is really, really easy to clean. So that's what I found to be able to build a barrier at a lower cost and at the size that we want. Suggestion.
I'll throw one out there for the people in BC. I'm just sort of texting back and forth with my brother who's in Vancouver. It's not as easy to wipe down or anything, but he could do reclaimed wood temporary walls that would be something he could rent to people. Because it's a wall, it's a barrier. You wouldn't have to spray it down like equipment. But he could whip them up with reclaimed wood and just be on a rental basis for a short term. So if people in BC, Vancouver are interested in that, they'd look a heck of a lot nicer if there's some cool reclaimed wood barriers. But people in BC, if you're interested, let me know. I can put you in touch.
Thank you.
Yeah, and Nick, if you give me the information, I can send it out to the group. So let's touch on Ontario. I know PEI is not able to join us today, but Ontario, a group is just getting together right now. So if there's anybody who wants to speak towards what you currently see happening in Ontario.
Sure, I can speak on that, Tricia. It's Mario here. So what I've read from the document that came out yesterday from the provincial government was, again, no mention of fitness facilities that I saw in there. So again, that seems to be pointing to us being pushed back into the third phase of opening. They are allowing some outside sports, much like Nathalie pointed out in Quebec. So that's kind of encouraging. It's nice. But still nothing to speak of specifically the fitness industry. One thing of note, and this is something that all of us can be concerned with, there's been a lot of surveys being done, and there was one recently done by, I believe it was one of the running magazines, online running magazines, a Canadian one, and they suggested that something like 46% of people with gym memberships will not be returning, even after they've been deemed all clear. Now, granted, this is a magazine that is specific to running, and they were promoting running outside as a result of the article, and it was something like 1,400 respondents, so it's a sizable sampling group. But it does speak to what we've all been talking about, is communication necessary to our membership base to make sure that they understand that even though we're not going back assuming it's business as usual, and that we are taking plans to keep everybody in place, but more importantly, that the activities that one partakes on in a gym are extremely important, particularly the strength component, and that's something you're not going to get from running outside. So anyway, that's something that I think is important. Oh, there it is, right there. Graham just put it up. Yep, thank you, Graham. That's exactly it. Perfect. So I'd recommend everybody have a look at that. Beyond that, I think Ontario, there hasn't been much action. Anybody else have anything to add to that?
Yeah, no, there wasn't too much on there. It just sort of, like you said, outdoor sports, individual outdoor activities, but there was nothing about indoor or gyms or anything like that.
I don't think we'll see it until the next phase is announced, and that's how successful I guess the current phase is. So we're going to be in a holding pattern.
What they seem to be. Yeah, what they seem to do in Ontario is is Doug Ford seems to be keeping his cards in his vest and just announces the next steps of what they're opening every week. So it's really hard to predict, but it seems like they're pushing the fitness clubs back. I think it's really important for our Ontario group to get our task force together to really push forward and get some action.
Oh, the one thing that's of note that I noted was they're going to be reviewing every stage, like every layer of rollout for 2 to 4 weeks. So that kind of using that math, realistically, even if we had approval in this stage, we're still looking at a mid-June opening, I think, at the absolute earliest.
So what I'll do is I'll organize kind of an Ontario team where you can all speak to each other together and then get things started. And then maybe we can have like an update as we go on for the next couple weeks. That being said, I know we are running out of time, but I do want to kind of put the bug in everybody's ear about speaking about the outlook moving forward for the different types of fitness facilities and training. So if I can kind of get, if Dave Hardy or Scott want to jump in about either big box gyms or studios on kind of the outlook, just to speak to it a little bit, and then we can talk further about it next week.
Yeah, I'll just say real quick, because I do have to jump onto another meeting here. The survey that the Running Magazine sent out is in contradiction to the survey that we saw yesterday in the Global Federation meeting out of Poland, which I think had 60,000 participants, Tricia, if you remember. And it painted a much better picture where 60% of survey respondents would come back to the gym within the first month. And then another 30% would come back within the second month, and then 4% in the third month. And it was only 6% that were considering not coming back. So a much different picture. So the Running Magazine, what we need to do as an industry association is likely counter that argument and do a campaign to let members know that we are organized, we are safe, and all the benefits associated with. So I don't think I have time to dive into the future of the business today. We can move that to next week, but I just wanted to share that survey from Poland.
Sure, thanks.
Richard, can you hear me? It's Angela from Vancouver again. There was an article in a German magazine that gyms were to be opened in Cologne mornings again at 6 a.m. and they lined up at midnight. Pretty much that was in Cologne, everybody, it's called McFit. Not sure what that would qualify for, but everybody pretty much was back.
Yeah, actually, there was an article or a Twitter post that came out. It was a picture of people lining up in Florida to get into a fitness club. So I don't know if anybody saw that, which is kind of a two-pronged approach, because yes, that's a good thing for our industry, because it allows people to know that there are people who want our businesses to be open, but then at the same time, making sure that people in line are safe distances apart and using common sense is also important. So there's something that is said about that as well. So, if anybody wants to add anything to today's meeting. Oh, Dave, yes, please.
Yeah, I was just going to give you a quick overview from a studio perspective. Yeah,
Yes,
we have a lot of studios in the States, and we have studios also in Canada through Orange Theory. We're seeing this week 330 of our US studios are opening up. And for us in Canada, looking at the US as a bellwether as to how it will go here, I think we really have to understand there's two completely different medical systems. In the US, much of it's private. Many hospitals aren't even accepting COVID patients. And the government's kind of got to the point where they realize even if they do put more testing and contact tracing in place, they can't ask people to stay home. That's just too un-American. Whereas in Canada, I think we have a much different system with socialized Medicare, and we're going to have our health officials look at it differently. My opinion, and from Orange Theory's perspective, we don't want to be on the leading edge of this. We think the giving the public time to get more comfortable with this is probably a better thing. I also think for those of you that are, thinking about putting up screens or even the 6-foot distancing, I think you have to understand what the public health officials are reading rather than what we're hearing. And there's a really interesting blog that came out from Aaron Bromage on May 6th, and essentially it talked about how COVID spreads through breath. And the key to this is to get infected, you need to essentially have 1,000 infectious virus particles, and a cough puts out 3,000. If you're in a volleyball-sized room, they have all these cases where 75 people out of 100 people in a choir are infected. So it's a combination of time and viral load. And essentially, her conclusion is any environment that's enclosed with poor air circulation and a high density of people spells trouble. And that's what the health ministers are hearing, are saying to all the ministers trying to open us up. So when I heard Natalie talk about what was going on in Quebec and how likely we're to be pushed to the end of it, I suspect this is where it's coming from. This is a Canadian viral expert who's probably written the easiest article I've read in this, and it's like reading French for me. I don't have a translator for it. So I continue to stand by, especially given that it looks like today the announcement that the wage subsidy program is going to be put in place until the end of August, on top of the fact that landlord support looks like it's going to be announced next week, or rent support. My inclination is we are probably better off waiting a little longer. I think public sentiment will change. At the end of the day, I've kind of come to this conclusion. It's not very likely we're going to see a vaccine. Everyone's going to have to kind of build up this herd immunity. But I think you're going to see the public more open to coming back to gyms. And everyone run your pro formas and see what your business looks like when you're doing 30, 40, 50, 60% of revenue. You may be better off paying 25% of rent for a little while. That's strictly my view on it. Now, personal trainers one-on-one with one trainer in a room, that might be a different situation than a spin class or a gym that's trying to run group exercise classes, or even people next to each other on a treadmill. So, that's kind of my update on the whole thing. And I hope that gives you some insight as to certainly how we're pushing as our company in Canada, which is, by the way, quite different than what's happening in the US. The US is just opening the floodgates because they realize they don't have a social system that can, one, has to pay for it as much, and two, could actually control people and tell them they have to go home and spend 14 days in quarantine.
Great. Thanks, Dave. And Evelyn has just asked if you can send that article around. So if you wanted to send it to me, I can send it out to the group.
I will send it to you, Tricia, because I don't know how to put it onto this chat.
Yep,
I'd have
no
to find
problem.
it on my phone, but I'll try my best.
No problem. Just send it to me and I'll send it out.
There was also that thing that came out of Japan showing people like at a buffet and then sprayed down. It came out yesterday and went on to every news channel about showing how the virus spreads like in that type of setting, and anything like that restaurant diagram, they go really quickly. So haven't seen anything on the fitness industry yet, or to show what it could be like that could be detrimental or positive depending on what it shows. But yeah, that type of stuff is, as soon as it gets out, that can show any type of how things spread. It goes, pardon the pun, viral right away on the news channel. So need to be cognizant of that.
On that note, I do want to thank everybody for joining our meeting today. Same place, same time next week. If you know anybody who will benefit from these meetings, please let them know. Happy to have people invited to these meetings. If you're currently not a member of FIC, highly encourage you to become a member. You can contact me or go to our website at ficdn.ca. /memberships to become a member. And next week, we will talk more about kind of businesses. So if you do look at your performa, like Dave had mentioned, it'd be a great way to kind of see where your club would be set at. Okay, so just kind of an outlook towards the future is kind of what we want to have a discussion about. And thank you all for attending, and I will see you all again next week.
Thank you.
Thank you very much. Take
Thank
care.
you.
Thank you.